Welcome back to Face the Nation. We now go to former FDA Commissioner Dr. Scott Gottlieb, who joins us from Westport, Connecticut. Good morning to you, Doctor.
Good morning.
We're around 70,000 infections a day, 1,000 Americans dead. You've described this as 4 separate epidemics. Where are we now?
Well, the epicenter of the epidemic right now in the United States has been the Sun Belt, states like California, Texas, Arizona, Florida. There are signs that the cases in these states are starting to plateau. That trend is most discernible in Arizona and Texas right now, where you see the positivity rate declining. It's a little bit more of a mixed bag in Florida and California. I think we're going to have to wait another week to see how those states net out. But there are unmistakable signs that the epidemic seems to be slowing these states. Now, at the same time, it seems to be heating up in other states. So if you look at states like Indiana, Ohio, Illinois, the District of Columbia, Georgia, Alabama, South Carolina, all hitting highs on the number of new cases being reported. So the epidemic may be shifting to other regions in the country. I think Arizona in particular is a very instructive case, because if they're able to start to bring down the epidemic in that state, largely what will have done it is some selective action by the governor. He did take some targeted mitigation steps like closing the bars, but more the collective action of individuals to withdraw some of their actions, stay home a little bit more, and more adherence to masks. And so if they're able to get the epidemic under control with those more targeted measures and more collective action on the parts of consumers, that's a good guidepost for the future on how other states may control their epidemics.
So Indiana, Illinois, Georgia, Alabama, you've highlighted them all. Would you recommend to those governors that they get ahead of it and do some of those things like shuttering bars and mandating masks?
I think that's exactly right. I think looking at what Governor Ducey did in Arizona is somewhat instructive. They did take some targeted mitigation steps in that state, like shutting bars, dialing back how many people can be in restaurants, closing movie theaters and other kinds of entertainment venues outside. At the same time, they did implement a mask mandate, a little late, but they did do it. And you did start to see consumers decrease their activity. Google mobility trends started to decline in the state. And so if that sort of trifecta of activity can have the effect of quelling an epidemic without the really significant mitigation steps that we took during the first wave of the epidemic, that's a hopeful sign. And it's also a suggestion that states that now have made gains in getting their epidemics under control, like the state of Connecticut that I'm in right now, perhaps they can keep their epidemics under control if they can just maintain adherence to things like masks and keep certain high-risk congregate venues like bars closed through the duration of the really risky period for this epidemic in this country.
And it's interesting because, again, we are seeing the private sector make its own decisions. McDonald's joining Walmart, Starbucks, other large retailers this week in requiring masks to be worn indoors. Is this a way around the politics? I mean, do you look at that and say, this is what we should be doing?
I think so, and I think it's a very good way around the politics. If enough businesses mandate masks in their venues, you effectively have a national mask mandate. You know, Delta Airlines announced this week that if you don't wear masks on their planes, they may ban you from flying on their planes for life. I think you're going to see more collective action in parts of businesses. I've been talking to some CEOs in the past week, and I think you're going to see more businesses come together to implement mask mandates in venues, especially indoor high-risk venues, to try to keep this epidemic under control. I mean, if we really can manage to keep the epidemic under control heading into the winter until we get to a vaccine or some kind of therapeutic that changes the clinical trajectory of this illness, just with masks, that's going to be something, relatively simple that we can all do that doesn't really change our lives and allows us to maintain what's really important to us, like keeping some businesses open, like getting our kids back to school.
Well, we are looking at going back to school within a matter of weeks. I have been talking to people this week about testing. I know people who have been waiting weeks for results. I know LabCorp told FT this week that it's taking about 4 to 6 days for people to get results. You've said they're basically useless unless you get them within 3 days. Do you have to fix this before we can open schools safely?
I think you do. I think one of the things you need to look at in a local community is whether or not you can get test results, because if you can't get test results back in a timely fashion, you really don't have a way to detect whether there's an outbreak in the community or in the school. And while we do need to lean forward and try to open our schools because it's important to children, we need to prevent outbreaks from happening in those schools. We can't just let infection run rampant inside the schools, and having good testing in place is going to be a critical tool. I talked to the CEO of LabCorp yesterday. they've gotten caught up. They're doing about 175,000 tests a week. They're going to be returning test results maybe within 2 or 3 days right now. Hopefully, Quest will get caught up as well. But if we do have other major epidemics, other major hotspots emerge, the testing system can become strained again. We're heading towards about 750,000 tests a day, and we'll probably be at a million by the end of this month. So we have a lot of testing capacity. The problem is when you have these major epidemics in multiple regions of the country, it can strain the system.
The CDC did come out with guidelines this week on how to reopen schools, but they left out when you should shut them down. What is the benchmark that parents need to be looking for to make that decision?
Well, look, the CDC didn't put a benchmark in that guidance, and I think it was unfortunate. I think in the absence of specific guidance to districts, you're likely to see more districts err on the side of caution. So I think CDC should have addressed this. It was probably deliberate that they didn't because they didn't want to address something that was politically charged. But for local school districts, I think they need to be looking at what is the spread within the community. If you have uncontrolled spread within the community, it's going to be very hard to open against that backdrop. I think you need to look at the density of students in the schools. So you'll see some districts, for example, opening the elementary schools to 5 days a week in-class learning because they can de-densify those schools. But maybe the high schools, they'll go to a hybrid model where it's harder to de-densify their schools. Schools are looking at retrofitting HVAC systems to improve air quality, the use of mandatory masks. And I think one of the most important features, and a lot of other countries did this with success, is keeping students in defined cohorts or pods. So you don't have a lot of students intermingling. You have the same 15 students gathering together.
But you're a parent. If you see a positivity rate above 5%, which is hotspot territory, do you send your kid to school?
I think somewhere in 5 to 10% it's starting to get iffy. Above 10%, I think that's a threshold where you really want to think carefully about closing the school districts because that is a sign that there is an epidemic underway inside that community. So those are the kinds of things you're looking at. I'm in Connecticut right now. We've gotten the infection under control. I think we're going to have the opportunity to open the schools here. But when you look at states like Florida or Southern California, I mean, California's already made the decision not to open the schools. I think it's going to be very hard in parts of Florida to open schools on time because of the outbreaks. And you're also seeing a lot of parents make proactive decisions to keep their kids home. So districts in Maryland, for example, that were giving an option to parents, a flexible option to parents, they surveyed those parents, and enough parents said we're not going to be sending our kids that the districts just made the decision to close the schools. And that shows that in the setting of uncertainty and the lack of specific guidance about how to keep schools open, I think more parents are going to err on the side of caution. That's why it's very important to get specificity out on what the hard metrics are that CDC didn't do in this guidance. There's still time to do it, but I think we need to think about things like positivity rate, what is the local spread, what is the testing capacity in place in a local community. Those are the metrics you want to be looking at.
Right. I agree. More information is always better. I'm glad you gave us a benchmark. Always good to talk to you, Dr. Gottlieb. We want to turn now to Gene Woods, the President and Chief Executive Officer of Atrium Health, which operates 36 hospitals and over 900 care locations in North and South Carolina, as well as Georgia. And he joins us from Charlotte this morning. Good morning to you. Well, we heard you testify before the Senate committee this past week, and you said at the time that you could process about 4,000 COVID tests a day, but that you're actually unable in your labs to do that because of shortages. What do you need to fix this problem, and does that need to come from the state or federal government?
Well, thanks for the question. I think, yeah, we have our own in-house capabilities to run our tests, and many times we can do actually same-day turnaround. The challenge that we've expressed, that I expressed at the Senate, was that we don't have enough reagents, which is actually the chemical compound that you use to process these tests. So we've asked, part of my request to the Senate was really, in part, we may need a national registry in terms of how these supplies are distributed to hotspots around the country. But we certainly, we believe that we at Atrium can do more. We want to do more. We just need some more of the testing reagents to be able to continue to serve the community as we have.
In all of your facilities, supply-wise, what is the area of greatest need?
Well, the good thing is that we spent the last several months stocking up on PPE. We've stocked up on ventilators. And so we feel like we're in a much better shape than we were before starting this pandemic. The other thing is that you've heard a lot about hospital capacity. The thing I'm as excited about is early on, we realized that we needed to have more capacity inside of the hospital. So we launched what we call a virtual hospital. And so imagine if you have COVID and you are actually being treated in your own bedroom, and we've converted people's homes and bedrooms into hospital rooms. We have monitoring, we do virtual visits. And if you need something like medications, we're working with the paramedics to actually deliver them into your home. So we've actually cared for about 11,000 COVID patients in their homes. And I think that gives me a lot of confidence going forward as we continue to battle COVID, that we'll have the beds that we need to serve the community.
You've also been looking at how to target the communities that have been hardest hit. And as we know from the CDC, Blacks and Latinos are 3 times as likely to become infected. What are you seeing in your community? Why this disparity?
Yeah, what COVID has magnified the disparities and the crisis in marginalized communities. And as we think about the legacy of Congressman John Lewis, he said, if you see something that's not right, we have a moral obligation to fix it and to address it. And that's why early on we engaged with communities of color, these marginalized communities. First of all, we had established relationships there, but also we had the data, we had the science. We saw early on, we geospatially mapped hotspots in our communities down to the zip code. And what we saw early on in the disparities in testing. So we worked with the pastors, we worked with the community leaders, and we loaded up mobile vans, medical vans, with supplies and personnel. And we said to the pastors in the community, where do you need us? So we went into the parking lots. We went wherever we were needed to. And in a matter of about a week's time, we eliminated the disparities in testing in these vulnerable communities. And our message to the community has been, we were there before this started. Yeah. We're going to be there throughout, and we're going to be here past this pandemic. And I will say, Margaret, as a Black man that also has Spanish heritage, this is personal for me. I feel the vulnerability of these communities. They could be my cousins, they could be my uncles, they could be my aunts. And it's also personal for our organization, from our board to our leaders to our front line. Our mission is to care for all, and that extends well beyond our walls. And we're going to be there for the long haul to deal with these inequities.
Are you going to ask in your conversations with Congress for your healthcare workers to be at the front of the line for a vaccine? And what do you see happening with distribution of it?
Yes, we have asked for the healthcare workers throughout the country, especially in hotspot areas, be a front line together with the essential workers, including teachers and so forth. So we've already made that request. The challenge, and I share this at the Senate committee, is that even when we have the flu season, 40% of Americans say they're not going to get vaccinated. And so what you heard in my testimony was that I do think we need to launch a national campaign, national PSA that really talks about the benefits of vaccination, because I'd be very, very concerned if we did get a vaccination and then we had a problem with actually adoption.
And we need to start talking about that. Gene Woods, thank you very much. We'll be right back.
Thanks.
It's 100 days until Election Day. This morning, we have a new CBS Battleground tracker that looks at national trends and the presidential race in 2 Midwestern states, Ohio and Michigan. President Trump won both in 2016, and our results today show Ohio is competitive. President Trump is up 46 to Biden's 45, but in Michigan, former Vice President Joe Biden leads. He's up 48 to 42. CBS News Elections and Surveys Director Anthony Salvanto joins us from his home today in Westchester County, New York. Good morning, Anthony.
Good morning, Margaret. How are you doing?
I'm doing well. I want you to explain to us, what is driving the vote in these 2 states?
Well, first thing we should say is that we see an increasingly expanding electoral college map because of what's going on in these 2 states. They're both pivotal, as you said. The president won them last time, and at least Ohio, he probably needs to win again. But you look at what's happening. Let's start with Michigan. Well, that state was hard hit by the coronavirus outbreak last spring, and there's still some lingering negativity about how the administration handled that response. In fact, most voters in Michigan tell us they think the administration's efforts hurt the state more than helped it. So that's number one. Then number two, we see big negatives among voters for how they think that president handles himself personally. And that is something that's accruing then to Joe Biden, where we find that more of Joe Biden's voters feel like they're voting more against the president than for Joe Biden. Now, I should add, economics here are something of a wash. It's about even between which candidates' policies would help revive the economy. In Ohio, some good news for the president. He's seen as a little bit better on protecting American manufacturing jobs, but all of that really adds up to not only are these states pivotal on that electoral college map, but also they exemplify the kinds of voters who swung to him last time and he probably needs again, Margaret.
You know, you don't get more personal than talking about someone's children. And the president's been talking quite a lot about trying to get kids back in classrooms, back to school this fall. How are voters receiving that?
So when we interviewed parents, we found a real wariness about sending their kids back to school in any regular way. They would prefer at most a limited reopening, and many would actually prefer not to have the schools reopen at all. There's still that real concern about coronavirus and what it might do to children. But where this cuts to vote, Margaret, is we see parents telling us that they feel like the administration is pressuring schools to reopen, and what that's doing is it's making parents feel, they say, like they're getting the impression the president doesn't care as much about the risk of coronavirus to children. And look, in any election, that empathy part is always part of how people select a candidate. And if there's an empathy gap there between the president and Joe Biden, that then is probably advantaging Joe Biden, at least for the moment, Margaret.
The president this week was tweeting about suburban housewives of America. That was the phrase he used. It seems that's who he is trying to target. I'm not asking what his strategy is, but I'm wondering why he is focused on this demographic. And who is that demo anyway? What does that mean?
So a couple of things in sort of a user's guide going forward to this election. One is you're going to hear the word suburban a lot. It means a wide range of things to a lot of people, often a stand-in for middle class, often a stand-in for areas of the country where there's more competitiveness. We often find nowadays that a lot of these suburbs are moving towards the Democrats. A lot of them did in the midterms in 2018. So that's something that the Republicans would certainly try to win back. Now, as far as the women's vote is concerned, we see that too with large gaps toward Joe Biden. He's doing better among women. In particular, we'll talk a lot about white college degree holding women. Those groups have been moving towards the Democrats, and that's the kind of trend that the Republicans and the president's campaign probably wants to try to slow down or reverse, Margaret.
And probably why he sent that tweet this week. Anthony Salvanto, thank you for breaking it down for us. We'll be back in a moment. Civil rights icon and longtime Congressman John Lewis is being remembered this week in a series of memorials and services. CBS News anchor and national correspondent Michelle Miller is in Selma, Alabama. Michelle, the nation has been in mourning for a week now. What has stood out to you?
Really, Margaret, the women who are taking the lead on speaking out about how this man not only paid homage to them and lifted them up, but they're wanting folks to know about it. I mean, the civil rights movement is something you heard about, the men in the movement, the Martin Luther Kings, the Whitney Youngs, the Big Six. They got all the attention, but you didn't hear about the Amelia Boynton Robinsons or the Annie Lee Coopers, women who were beaten for daring to cross this bridge or daring to try and register to vote. And women like Cheyenne Webb Kreisberg, who at 8 years old walked across this bridge and were counseled because she was so traumatized by what she had seen, the youngest person to walk that bridge. She spoke about him last night at the AME church. She spoke about how he stayed in touch with her to these past 60 years. Or the Terry Sewells, the first black woman to represent the state of Alabama ever, who went to Capitol Hill. And the minute she got there, she said that Lewis was there to greet her, to mentor her, to guide her. In fact, he insisted that she become a co-pilgrimage maker every year to cross this bridge with her and was always there to take a stand with her. I think of the Women's March of 2017 and the fact that many of those leaders, including Tamika Mallory, who said he was the first in Congress to legitimize that movement. And she showed me a letter that he had written about a week before he died to not just her, but others in the movement, saying, I pass the torch on to you. I pass the torch and I know it will burn brightly. And I just want to mention one woman who walked here wearing a purple t-shirt. It said YOIE, standing for, she said, your only is enough. Inspired by John Lewis, she said, because, you know, if you can only register 5 people to vote, then that is enough. Again, his mantra, if you see something wrong, say something, do something, and that is his lasting legacy.
I love that passing of the baton, Michelle. With this procession and this process of mourning, what should we expect in the coming days?
The family does not want people to travel because of the pandemic, of course, but a lot more taking place. This afternoon, Lewis will lie and repose at the Alabama State Capitol in Montgomery, which ironically was the end point for the famous 1965 march. On Monday, there's a procession through the streets of the nation's capital and an invitation-only ceremony as Lewis's casket arrives to the U.S. Capitol Rotunda. Later Monday evening, an outdoor viewing with social distancing protocols in effect on the east front steps of the Capitol. That viewing continues on Tuesday. Wednesday, he will be returned to his adopted hometown of Atlanta and ceremonies at the Georgia State Capitol. Finally, Thursday, and the official funeral at Ebenezer Baptist Church, the pastoral home of the Reverend Dr. Martin Luther King Jr. And although that will be Ebenezer's New Horizons Sanctuary, it is still something that is expected to be very special. The burial that afternoon will take place at Atlanta's Southview Cemetery. He will be laid to rest next to his beloved wife, Lillian, who passed away back in 2012. So a near full week of celebrations in honor of John Lewis. Margaret?
A celebration of his life and his message. Michelle Miller, thank you. I know you'll be covering it for all of us. We'll be right back. That's it for us today. Thank you all for watching. Until next week, for Face the Nation, I'm Margaret Brennan.